address the issue of racial and ethnic inequalities and the impact of the COVID-19 crisis. The City of Boston has been long committed to the understanding and reducing of health inequities. We have been long committed to eliminating the injustices that make some groups more vulnerable to poor health than others. Equity is at the core of our health policy as a city. Equity remains a major focus as we respond to the coronavirus pandemic. With all the reports that we have seen of the coronavirus hitting people of color harder in places all over the country, such as Detroit and Chicago, this is certainly disturbing. We've been taking a good hard look at the numbers in Boston to understand and address any inequities that exist, because we believe that data is critical. We've been working to collect as much data as possible about race and ethnicity in patients in Boston, and I've asked the state and our surrounding communities to help us and do the same. Our data is not complete yet, but we are releasing the data on race and ethnicity that is available to us today. It accounts for 62% of the total coronavirus cases in Boston, and we will continue to collect data to fully understand how deep these inequities run and how to help every Bostonian understand the virus and its risks. It looks at the initial data, and we do see disparities, and it does concern me. In order to target these issues directly, today I'm forming the COVID-19 Health Inequities Task Force. This task force will review the data on health inequities that face African American, Latino, and Asian population here in Boston. It will analyze the data and best practices related to the COVID response. The task force will strengthen our strategy for equity and access to service. It will help us provide recommendations for resources and strategies that the city can use moving forward. The members of this task force will reflect the diversity of Boston's neighborhoods and experience in Boston's public health and community outreach communities. I will announce those members later on today. The research we're doing should help us understand the impacts of immigrant communities are facing as well. I want to remind everyone that they're not to be asked about their immigrant status when seeking medical help, and they should not be afraid to approach and get medical help. So we want to make sure that people do that. The information that we're collecting there on this data is kind of the same information that we're collecting in neighborhoods where we can see where the cases are happening. It allows us the opportunity to formulate a response to go into those different neighborhoods to try and flatten out those numbers that we're seeing. In some neighborhoods in the city of Boston, we're seeing higher numbers in other areas. Some of it's due to testing and other reasons, so we want to be able to have an appropriate response in all of our communities here in the city of Boston. The city is also working with hospital partners to receive any data that helps our understanding of this. The Boston Medical Center is a hospital that has served a diverse community for years. They have told us that the COVID is disproportionately impacting communities of color. They've seen a 25% increase in the number of patients of color that they had treated for COVID-19, an increase in percentage of patients from Dorchester, Hyde Park, and Mattapan. Mass General Hospital has told us that the patients they're treating for COVID are disproportionately Spanish-speaking. They think, and I agree, that we need to focus more on the Latino community around Boston. Some of these hospitals, along with the city, are working to address the issue right now, and we're going to support these efforts. It's important to note, as of now, private issues do come into play on how we report race and ethnicity data in the deaths of COVID-19. Currently, the information, the data identifies fewer than 5 deaths for several demographic groups. Numbers this small could lead to the identification of patients that violate their privacy. Personal data like this is protected under HIPAA laws, and we are certainly going to respect that. Finally, before I take questions, I want to speak directly to the people of Boston. I know that it feels like we've been battling this crisis for a year. The truth is, we still have a long way to go. I need each and every one of you to be reminded and to stay focused on our collective goal, stopping the spread of this virus to protect our most vulnerable. I keep reminding people that you're not powerless. You have the power to protect yourself and those around you. Every little thing can make a difference. Staying home and away from others whenever you can and is possible is important to do. There should be no gatherings or crowds anywhere for any reasons. plans. That is really important. I want to repeat that. We're asking you not to no visiting or meeting up with friends or families who are not a part of your immediate household. Only go out for essential items, and I mean essential items. Keep your mask on, covering your face the entire time. I'm asking people, and we've done a good job with this, thank you, Boston, respecting the curfew. We're asking you not to leave your home between 9 p.m. and 6 a.m. We're asking people to wash your hands as often as possible with warm water and soap. If you can't remember the last time you washed your hands, just do it again. Use hand sanitizer. Cover your mouth and nose when you sneeze. If you come home from being out, wash your hands immediately and disinfect anything that you touch. I'm serious when I say that every one of these actions could save your life, and it could save someone else's. What we do during these next few weeks is critical to flattening the curve and saving our lives. None of us want to look back 2 or 3 weeks from now and think we could have or should have done more. Now is the time. The city needs you. The vast majority of people are doing an incredible job, but we're still seeing instances where people are gathering in groups. A particular concern that people are still visiting senior housing and assisted living communities. I want you to remember that seniors are amongst the most vulnerable members of our community right now. It's heartbreaking not to see our mothers, fathers, aunts, uncles, grandparents, great-grandparents. But the best thing we can do for them right now is to practice social distancing. Please respect the request from management of senior housing facilities during this important time. I know these precautions are difficult, but we are missing our loved ones and we are missing our traditions. This Sunday is Easter, and we're in the middle of Passover. I urge all Bostonians not to be traveling, do not have family gatherings, unfortunately no big dinners this Sunday. We can't go to temple or to church, but many of us are holding services online. There's plenty of ways to get connected with your loved ones virtually. I've never spent an Easter Sunday without seeing my mother. This will certainly be the first. I'm going to talk to her and call her. I'm going to tell her I love her, but I'm not going to see her because I love her. For many people, not seeing family on Easter is hard to accept. But listen to me. God certainly understands. Easter is a time of reflection on permanence of love and faith and how we all overcome darkness. This Easter, I urge you to respect life by protecting life. Take the time for reflection and prayer at home to think about what we have to look forward to when we overcome the darkness together. I want to thank you. I have several questions here from the press that were sent in beforehand, so I'm going to go through those questions, and then I'm going to open it up to the press that's presently in front of me. From Danny McDonald at the Boston Globe, what's the mayor's reaction to dozens of construction sites apparently violating the construction suspension in Boston, prompting the city's inspectional services to shut them down? In this week, we've shut down 94 jobs, mostly small jobs, and they had to be shut down. And I think my remarks today is pretty much all I need to say to construction companies. If you care about your parents, if you care about your loved ones, care about the workers that work for you on a daily basis, that make you money, make sure you take care of them by letting them stay home and don't force anyone to work. And we will shut jobs down in the city of Boston until we think it's safe to go back to work. From Catherine Clark at the Boston Business Journal, Mayor Walsh, you stepped in to call Ben Ashkenazi to ask him to give tenants of Faneuil Hall a reprieve for April rent. Do you have plans to place accommodations for other commercial retailer tenants in Boston that cannot make rent payments as a result of business shutdown? What I'm asking for is that all landlords in the city of Boston, whether residential or commercial, be flexible as they can in offering deferred payments to their own tenants. We have put in place measures to ensure housing stability, protect against residential evictions, and offer funds for renters who cannot afford to pay rent. So I'm asking businesses also to help us. We've also launched the Small Business Relief Fund for small businesses struggling to meet the payments. To date, we've received over 1,800 applications, so I'm asking people to help. With that, I'll open up for questions from the press that's here. I can't really see it because there's a big light here, so just call out. Yeah.
Regarding your equity task force that you're forming to deal with the racial inequity issues that are going on, how long do you think it will take before the practices that it finds from analyzing the data get implemented? in the city?
Yeah, the question is from the task force that we're creating, and when the task force starts to do their work, which I think is going to be tomorrow, how long will the responses come to start implementing in the city? We pretty much have a standard approach right now in the city of Boston since the coronavirus started and the crystal group came on, is that we allow 24 hours to solve a problem. So as they address those problems within 24 hours, we're going to have a response, hopefully, on all those cases, unless it's something beyond our control.
Can I ask one more
Yes.
question? Regarding the Boston Public Health Commission report that came out on for the data for ending on April 2nd, that showed Hyde Park, Mattapan, Dorchester, East Boston being much higher as far as the coronavirus incidents. Is there anything that can be proactively done for those neighborhoods while the data is still being accumulated to implement that?
Yeah. The question is on the neighborhoods that are seeing the highest rates of coronavirus, East Boston, Dorchester, Mattapan, Hyde Park. Has anything been done in those neighborhoods to address that? Is that the question? Will anything be done? Yeah, will anything be done? Yeah, will anything be done in the interim before the task force is up and running? And the answer is yes. I mean, part of what we're doing is notifying communities, in communities of ethnic communities that have language barriers. We're trying to increase our ability to get messaging out into communities, into families, that English might not be the first language, and how do we explain to people? We're also going to be targeting through papers and through social media ways of trying to explain to people. I mean, when people get coronavirus, somebody contracts the coronavirus, they're generally catching it from someone else. It's not increasing in a neighborhood because of a neighborhood or because who lives there or because of the color of your skin. What's happening is a lot of it comes down to practicing social distancing. It comes down to the stay-at-home order that the governor put in place. It comes down to all of the different things that we're doing as far as taking care of yourself. At the end of the day, that's what we have to continue to do. The intention behind the task force and getting the information is, can we dive into those numbers to see what the situations are? One of the situations in East Boston is that we're seeing clusters of coronavirus kind of popping up in households, which means that the entire household is getting coronavirus. And that can push the numbers in a higher way. So what the task force is going to do is look at the disparity and look at ways of resolving that, but also seeing if there's an issue on testing and not access to enough tests. Clearly in those communities, a lot of those folks have had access to tests. So we're going to be looking at the data, they're going to analyze it and do some cutting of it.